A new report today finds opioids are killing and harming Ontario's First Nations people at a much higher rate than non-First Nations. The report is titled Opioid Use, Related Harms and Access to Treatment Among First Nations in Ontario. CTV's Eric Taschner breaks down the numbers for us.
At an alarming rate, First Nations people are disproportionately impacted by the opioid overdose epidemic. The rate of opioid-related deaths for First Nations people in the province tripled between 2019 and 2022.
Well, unfortunately, it's not something that we already didn't know.
A 36-page report studied data from 2013 to 2023 and found First Nations people were 10 times more likely to visit a hospital for opioid-related toxicity.
Intergenerational trauma from the residential school system, from colonization, and those impacts are long-lasting, and that can lead to patterns of substance use.
The research found opioid use was higher among First Nations, particularly among those living outside their communities, compared to non-First Nations. Hospital visits due to opioid-related toxicity are also higher among First Nations people.
Northern and more remote communities face a lot of difficulties just because of their geographic spread in terms of trying to provide access to safe spaces to use drugs or to treatment.
The research does give some cause for hope. Death rates have stabilized.
First Nation-led programming initiatives and that are having great success, albeit not what we considered in the opioid addiction circle as conventional practices, have had great results.
In 2021 and 2022, nearly 400 Indigenous people died of an overdose, and First Nations people were dying at a rate 9 times higher than non-First Nations people.
We're lobbying the federal government to say, look, our police services are dealing with a wide variety of issues that are impacting community, including organized crime that is bringing opiates into community. We need police services as well to be an essential service.
The Chiefs of Ontario plans to examine data on publicly funded treatment programs to determine if they are adequately serving First Nations throughout this ongoing opioid crisis. Eric Taschner, CTV News, North Bay.